There are different treatments for skin cancer. The first one is surgery, which is just when the tumor is cut out of the skin. And if skin cancer cannot be removed by cutting it out, that is when a person would result in using other treatments. The next treatment is radiation therapy, which uses high energy rays to kill cancer cells. A beam focuses radiation on the tumor. The treatment is much like getting an x-ray, but the radiation is stronger, and the procedure is completely painless. Radiation therapy is often used as a treatment after surgery in the area where the lymph nodes were removed, especially if many of the nodes contained cancer cells. This reduces the risk of the cancer coming back. Some side effects that come from radiation therapy depend on where it's aimed. It might include sunburn-like skin problems, hair loss where the radiation enters the body, fatigue, nausea, or vomiting. Targeted therapy is another type of treatment, and this is just when certain drugs target the mutation in the BRAF gene. About half of all melanoma cases have mutations in the BRAF gene. These mutations cause the gene to make an altered BRAF protein, which results in the melanoma cells growing quickly and dividing rapidly. A type of drug that's used for targeted therapy is Zelboraf, and this drug targets melanoma cells with the BRAF gene. It causes the tumors to shrink in about half of the people who have this mutation, and it also prolongs the time before the tumors start growing again and helps some patients live longer, although the melanoma usually starts growing back again eventually. The most common side effects for this are joint pain, fatigue, hair loss, rash, itching, sensitivity to the sun, and nausea. The next type of treatment that's used for skin cancer is immunotherapy, and this stimulates the body's immune system to recognize and destroy cancer cells. And this drug is given in an IV usually, and it is used for patients with melanoma that can't be removed by surgery or that have spread to other parts of the body, and it has been shown to help people live an average of several months longer. Some side effects that come from this treatment are flu-like symptoms such as fever, chills, aches, severe tiredness, drowsiness, and low blood cell counts. Another type of treatment that can be used is called imiquimod, and this is a drug that is applied as a cream, and it stimulates an immune response against skin cancer cells. It is FDA approved only for superficial basal cell carcinomas and has cure rates generally between 80 and 90%. And then the last type of treatment that's used for skin cancer is chemotherapy, and this uses drugs to kill cancer cells. The drugs can be injected into the vein or taken as a pill. These drugs travel through the bloodstream and kill cancer cells that have already spread beyond the skin to the lymph nodes and other organs. And because chemo drugs attack cells that divide rapidly, it affects other cells in the body, such as those in bone marrow, the lining of the mouth and intestines, and also the hair follicles. Because of this, the side effects include hair loss, mouth sores, loss of appetite, nausea and vomiting, diarrhea, increased risk of infection because of the few white blood cells, easy bruising or bleeding from too few blood platelets, and fatigue from too few red blood cells. And that's it for skin cancer treatment.